Hey everybody, I am going to start setting up dialysis, so I'm going to kind of walk you through what my process is, and if you guys have any questions, throw them in the comments. Hit the like button, follow, do all that claiming stuff or whatever. I don't know what it is, but I'm going to show you all typical every other day of dialysis. So here we go. All right. So, as you can see, this is our bed. Christina's side is this side, my side is that side. There's more room on this side, so I put the machine over there when we're doing dialysis. So, since you have to be clean, you have to be kind of sanitary, but you have to be very sanitary when you're doing home dialysis. She has her own separate blankets that we use when we do treatment, and I'm going to show you that process. We also got adjustable beds for Christina, so she can adjust herself up and down depending on her blood pressure. So walk with me and follow me how to do this. Alright, so as you can see, we've got the adjustable beds for her. Okay, I lay down flat while she's doing it. Then I take her blankets, I fold them up. Then I bring my blankets over. Then, like I said, I have extra blankets that I use just for dialysis. It's a nice minky. It's really nice and comfortable. She has to be in bed for 7.5 hours and can't move, so I want to make her as comfortable as possible. And then she has her special blanket that my daughter made for her. Okay. So now you can see that her side is ready for dialysis, and now we will go unpack some of the meds that we got. Okay, we get these every once in a while. In fact, I'll be giving this to Augie so you can ship some stuff off. But this is some special medicine for her hemoglobin. And if you guys have any questions about dialysis or home dialysis, put them in there and we can address them as they come. I'm kind of new at this, so if I miss your question, ask again. But let's unpack this now. Alright, they pack this like it's pork knots. Alright, so they pack a whole bunch of stuff just for one thing. But you got the prescription, got the ice packs, and you have, okay, this is Macera. Macera is what we give for low hemoglobin. If you're a dialysis patient, you usually always have low hemoglobin. So she gets this about every 2 weeks. She usually hovers pretty good, but she's been a little bit low lately. But her numbers are actually amazing right now. Well, amazing for dialysis. And I'm going to pack all that stuff back up. And I'm going to put this out to the side so I can give it to Augie. Alright, now, so I do my setup a little bit different than everybody. Okay, so as you can see, my water supply is actually mounted against a wall. Most people have it on the back of the machine. I don't do it that way. I do it to where I can move the machine around. So when I do my fills and all that stuff, it is actually out here because our bedroom isn't the biggest. So I want to give us as much room as possible. And so let's push the machine into bedroom. Hopefully I don't fall. That happened. Okay, so we'll try that again. Alright. There we go. Oh, okay. Hopefully that don't fall. Alright. So we have the machine, and we will move it out of the way. Alright, so as you can see, there's the machine. We are just going to push it into the bedroom. And the reason we do this is so that it's not in the way. So, and I'll show you once I get it all set back up. And I forgot to move the carpet. So, as you can see, we have little rugs. Get that moved out of the way. And pull the machine in. And it seems like a pain in the ass, but it's really not that bad. And I usually can do this with 2 hands, so it looks more awkward than what it is. And bring that around there. We plug it back in. And push this up against it. Alright, and I will set you guys back up. Alright. There we go. Alright, so if you hear that beeping, that beeping is the pure flow. Okay, so it's yelling at me saying that was a power failure. It wasn't, because I unplugged it. So just hit green, or red, then green. Now I always hit green again, just to make sure that it's flowing, and it is. So now we're going to prime a cassette. Just a second. Alright, and then this is where we go. Alright, and then this is where we glove up. Just make sure nobody's had any questions. Remember, if you have any questions about dialysis, okay, I don't do medical. Glove up. Just make sure nobody's had any questions. Remember, if you have any questions about dialysis, okay, I don't do medical. I was an aircraft mechanic out of the country, telling people and showing people that if a blind chick and a dumb mechanic can do this, anybody can. So, you know, anybody can do this. Alright, and let's see. Oh, looks like there's some messages. Let's see. Sorry guys, I don't do this very often, so hit that like button and all that stuff and send a heart or whatever. I don't even know what it is. But wow, you guys are awesome. Thank you. Alright, so get our gloves. Put them on. When you're doing dialysis, you got to be as clean as possible. So put them on. When you're doing dialysis, you got to be as clean as possible. So the door is closed and the AC is off right now because any airflow condition. Alright, come with me and we will do a cassette. Alright, so what you do is you take the machine and open that door. I don't know. You got your saline, you got your cassette, and if you know me, you got your burritos, and I'll show you that in just a second. Alright, so open your saline up, put the bag off to the side. Actually, I'm going to see if I can position you guys better so you guys can see the machine and all that. Yeah, there we go. And thank you for those likes. Hit that whatever and do your magic or whatever you do. I don't even know. Let me see if there's any questions. And remember, if you guys have questions about home dialysis or even just home medical, put them in. Because, you know, 1 in 7 people suffer from kidney disease. So I hope nobody has to do this, but we've been doing this for just 7 years now. So, You know. All right, so you got your NxStage cassette. Okay, everything's enclosed. Okay. This bag becomes my trash bag for everything. All right, then you have a whole bunch of tabs. Okay, so pull all those tabs off. The recirculator, we just put that out of the way. Then we have the connectors. You just make sure those are tight. And there's 2 of those. So just make sure it's tight for when the saline is going through it, it isn't going to leak anywhere. So all white tabs come off. And then any caps, just make sure you tighten. Because you don't want any leaks. If you have any leaks, that can be a source of infection and cause a big giant mess. Alright, so now, when you put it in the machine, just grab the lines. Oh, I forgot one. Okay, so when you put it in the machine, just grab the handful of lines. Just pick it straight up. If you do it funky, it's going to tie in a knot and stuff like that. Then, if you can look at the cassette, see that smiley face? That goes towards you. Okay, then this is just going to go in the machine. Slide it in. And then you close the door. And like I was saying with the lines, then you just grab this spike and drop them. If you do it right, this just drops the way it's supposed to. And of course, when you're on camera, it gets funky. But there's no kinks in that line. I'm going to move the camera so you guys can see me stabbing the bag. Okay, so then you have your saline and you have a spike. This spike has to go in the saline. It has to go extremely fast because, again, any air that's present or touching any of this stuff, it can be infection. So hopefully you can see how fast I do this, but it is a quick bam, bam, bam. Okay, so you twist this, you twist the opening for the saline off. Okay, pull the spike and stab. And if you do it right, it doesn't leak anywhere. Okay, so then you have the saline. Hang that up. And if you're not aware of NxStage products, okay, this is called the Guide Me. Okay, this will give you step by step. Okay, God forbid something happened to me. You know, anything could happen to any of us. We could drop dead, we could, you know, anything. So, this would do step by step of how to perform dialysis. Do you need training and all this stuff? Yeah, but Christina knows how to do all this stuff. So if something happened to me, she could walk people through this, and it actually gives you step-by-step instructions. I'm not going to use the instructions because I'm that freaking awesome. So here we go. We're going to start the prime, and as you can see, it does it for 23 minutes. So we have 23 minutes, and I take that time to get my burrito ready. So that's going to be fun. So let's go ahead and do that. And if any of you guys have any questions, I'm an in-center dialysis nurse. I've never seen home actually work. Thanks for what you do. No, thank you for what you do, because it's people like you that motivate us to go home. And the biggest advice I can give you, Sydney, is just mention all the modalities. And, you know, mention PD, mention home hemo. There are some patients that love in-center. And in-center, if it works, amazing. It works for them. Let me see if there's any other questions. But Sydney, thank you so much. All right, so now you get to see my cassettes. My burritos. And if you don't know, I rely on these. Okay, these are what make treatment possible. At least they do for me. Okay, I rely on these. Okay, these are what make treatment possible. At least they do for me. Okay, when we started this, I was sweating underneath an aircraft, 8, 10, sometimes 12 hours. I would be dead coming home. I would be so tired. This makes it so you don't skip any steps. This has everything I need to do dialysis. Okay, so it's kind of like when you're putting your car back together or you're putting IKEA furniture together. You don't ever want to have that stray bolt left over. Okay, this makes it so you don't have that stray bolt. Puts it all in order. So now I'm going to show you how I put all this together. Alright, I don't even know what this means, but flash goal, give me hearts or gifts, or I don't even know what it is, but Sydney, you're freaking awesome. Thank you. I'm going to show you my burritos now. And Sydney, if you have patients that are just having a hard time dealing with this, send them our way. We got Facebook, TikTok, YouTube. I do videos like this all over. You know, we just got back from Boston, so I showed how to hang dialysate in Boston. So I am going to show you my burritos now. Alright, let me make sure, see if I can get this. Alright, okay, so this is my tray. My cleans go in here, my dirties go in here. I'll show you how that works. Okay, got the rubber band, put that off to the side. I might as well show you my cart. Okay, everything in this burrito is in my medical cart. So God forbid something happened with that, or I forget something, I have everything. Okay, got gloves, masks. I have sensors for lead sense. I'll show you how that works. Then I've got needles and syringes. I have vials to take home labs. We actually just did labs, so I don't have to do that. Then I have gauze. Then I have heparin. I'll show you how I pull that. And I've got more needles. And then Beneful. Okay, if you don't know what that is, when you are doing dialysis, you're usually always low on iron as well. So this helps that I can give her iron instead of having to go in a clinic and all that stuff. I can just do it myself. Alright, so let's see if we can get this where we will have it. Okay, so we have before treatment and after treatment. This packet right here is for after treatment. So this goes underneath. I have a organized chaos of what I do. It looks like a lot, but it's really not that bad. And like I said, if a dumb mechanic and a blind chick can do this, you guys can't too. And I think I have a question. Definitely will. I've heard about you from Eric Hellip. He's your cousin? Oh, I work with him. So that's cool. I have known Heidi and Eric for, geez, I want to say almost 20 years now. I worked at ATK with Heidi and Eric when they were there, and then we're on base together now. So when you see them, tell them Mike said hi. And I talked to Eric today, actually. All right, so we have the needles. Okay, I've got 4 of these. There's one. And like I said, I've got clean and dirty. Clean, and when I actually start dialysis, I will actually put the dirties on this side so it's not contaminating or anything. Okay. 2 needles. These smaller needles are for administering heparin into a CVC. Christina has a CVC currently, and so some people get a lot of pushback on that one, but we don't, because we're freaking awesome. Alright. 1, 2, 3, 4, and then I have a 5th one. This one is actually for my heparin machine. This is for the heparin pump. This will administer heparin for the entire treatment. I'll show you that. And I have another little syringe because there's a left and right to a CVC. So both of them get packed with 1.9. And I'll show you that. Then you have saline pushes. I'm really bad at looking at these questions, so if you have questions, just ask them again if I don't address them. I don't know. Of course, when somebody's watching, it's like Fort Knox trying to get into it. Other times, you just touch it and it pops open. Okay, then I have alcohol to clean those CVC as I do connections. Then I have alcohol for heparin, and I will go ahead and show you that. Then I have everything that kind of hooks on this cart. This is my trash bag for dialysis, so at the end of treatment, everything goes in the trash. Then I've got my alcohol. Throw that in there. Get your heparin out. See if there's enough in there for both. There might be. Okay, and then you could sing the ABCs. A, B, C, D, E, F, G, H, I, J, K, L, M, P, Q, R, S, T, U, V, W, X, Y, and Z. Okay, so that's clean. Now, there's a magic trick. You get the heparin, stab it in the bottle, and it's magic. It's just coming in the bottle automatically. I don't know why that's cool, it just kind of is. Okay, and she's going to get 9 milliliters, 9,000 of heparin, and that gives her a continuous dose throughout treatment. I'll show you how that hooks up. Then we've got 1.9. 1.9. And this is for after treatment, so we'll just get that out of the way. And same with this one again. Alright. And I'm so close. I'm gonna need another bottle. So we'll do another bottle. Okay. Grab another thing of heparin. Check the expiration date. Always good. Because the heparin lasts a long time. A, B, C, D, E, F, G, H, I, J, K, L, M, P, Q, R, S, T, U, V, W, X, Y, and Z. Then get the last little bit that I need. And 1.9. Throw that underneath because we do that after treatment. Then throw this back in your medical cart. Alright, so now we're gonna might as well show you the red sense. Okay, this is red sense. Okay, this is so that we can sleep during dialysis. Let's see if there's any questions. Hey, do you do a lot of TikTok lives? I came on here to do a live while I'm treating. We do, but let's see, chronically chill. Thank you for the likes, and again, I don't really know what I'm doing. I'm new at this stuff, but we do nocturnal, so it's kind of hard to record treatment because we hook up and go to sleep. And not many people do that. We'll pretty much, I don't even know of a handful of people in the country that do it. And I love it because I can go to sleep and I'm not up all day long doing the treatment. If you don't know, Christina is legally blind. So when she started home hemo, I became her eyeballs. So this is red sense. Okay. This sits on a CBC, and if it detects any fluid, an alarm goes off. That's really annoying. I'm going to show you that. Hopefully you don't tip over. And we have 13 minutes left, but we have plenty of time. Alright, so you just turn it on. Okay, as you can see, it's red. When you put it in, it will pulsate. I don't know if you guys can see it pulsating. I doubt you can, but that's telling me it's working the way it's supposed to. And when we hook up, that will go on. This is the heparin pump, okay? This is what will administer her heparin throughout treatment so that she doesn't clot. Okay, since we're doing 7.5 hours of treatment, I hate when the heparin bottle goes out. I know, don't you think that's so annoying? The heparin bottle, oh, it's Sam. Sam Sue. Awesome. I'm Sam. It's the podcast name for my screen name. Oh, okay. Sam Sue. We just got done seeing you. That is awesome. I opened TikTok and you were here. Sorry you had to see my ugly mug, but at least you get to see how it's set up. So, and people were asking about this in Boston. You can see my pins. These are my blood donation pins. I take blood donation very seriously because it can save people. Christina's had so many blood transfusions that it's not even funny. But this is all my steps for doing dialysis. Okay, and then I also have back here, I have a typical alarm page, and I haven't had to use it for years, but at the very beginning, it helped out a whole bunch, and thank you. I am quite attractive, huh? Anyways, so I have my needles all ready. I've got my heparin ready, and now we're just gonna wait for the machine to clock down. And I don't know how to pause these, so I'll just do another treatment, or I'll do another live when we hook up. Hopefully you've learned something. If you liked this, again, I'm only getting advice from my buddy Augie at work of how to do these. So hit that like button, hit that thing up there, and if you guys have any questions, reach out, because if you have any questions about labs, if you have any questions about alarms, okay, maybe I can get with Christina and I can convince her to do a, I don't really want, you know, it's going to be boring as hell, but maybe I can do a 7.5 hour live where you can see what our typical dialysis is, because I cannot remember the last alarm that we had, or at least the last alarm that made us stop treatment. You know, we get the typical, you know, air alarms or whatever, you know, we always get that. Well, no, we don't always get that. We rarely ever get any alarms, and we pretty much hook up and it's just another day. So if you have any questions, please send them to me. And trying to see if anybody else had any questions. Thank you for all those likes. Thank you for all of that stuff. Again, I'm new at this, so if you see me live or whatever, do your magic fingers and do whatever you need to do. But you guys are awesome, and I should be signing on to record when we hook up. See you guys. I don't even know how to tell how long I've been on. Okay.